want to talk a little bit about eye health and eye diseases today. The eye is part of the brain. The brain is part of the eye, so whatever's good for the brain is good for the eye. Whatever's good for the eye is good for the brain. And I want you to get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Dead Doctors Don't Lie, and the book Rare Earths Forbidden Cures. It'll kind of cover everything we're going to cover here today. And it gives you good basic principles for the health of the eye. Now, the eye requires all 90 essential nutrients, just like your brain, your cheeks and your tongue and your heart and your lungs and your liver and kidneys and muscles and bones and cartilage. Every tissue in your body, including the very complex mixed tissues in your eye, require the 90 essential nutrients. And there's, nerves from the brain that control the eye. The optic nerve, of course, brings the light into the eye, and so you can see color and all that kind of stuff. You get the rods and cones in the retina of the eye, which determines color and so forth. And then you have the cornea, which is the clear part of the eye that the light comes through from the outside. And that can get foggy. And you see this a lot in kids when they're vitamin A deficient. And usually they're going to be vitamin A deficient, especially if they're getting formulas, which is usually rich in vitamin A, or breast milk, it's usually rich in vitamin A. And you get these cloudy corneas. That usually means they're vitamin A deficient because they cannot absorb. They have a gluten intolerance, and they're beginning to lose the villi, the absorptive surface in their intestines, and so they're absorbing less and less percentage of all nutrients, including vitamin A. As they get a little older, that cornea, which is cloudy now, begins to erode. You get ulcers on the surface, and the pressure begins to go up a little bit inside the eye, and the inner membrane, and of course the cornea is a multi-layered membrane, the inner membrane begins to bulge through, kind of like a little piece of your little finger sticking out through the cornea of the eye. It could be just a little pea-sized blister, and this is called keratoconus. This is a reason why a lot of kids go blind in early life. A lot of the famous rock and roll singers who were blind, like Stevie Wonder and Ray Charles and stuff like that, those guys were blind because of keratoconus, a vitamin A deficiency. Then let's see here. Let's look at something you see in adults. Macular degeneration is the most common cause of eye blindness in adults, and this is an accumulation of the pigment, kind of like liver spots and age spots. The actual name of the pigment is ceroid lipofucsin. It's kind of this golden brown color you see in the skin, back of the hands, and the face and neck of people that have a lot of free radical damage to the fat in their skin. When they've got these in the skin, guess what? They've got it in their eyes. They've got it in their bone marrow, in the brain, in the liver, in the lungs, and so forth. It's everywhere. And the more you have, the more vision you lose. Okay? We'll talk about how to deal with that in just a moment. Glaucoma has to do with obstruction of the little arteries in the eye. You're getting, like a coronary artery disease, you get blockage of the arteries in your brain, blockage of arteries in your heart, blockage of arteries in your kidneys. You also get blockage of the little arteries in your eyes. They're very tiny, and the pressure begins to go up in the eye, and you get glaucoma. And you can certainly lose your vision from that because the pieces inside the eye, the lining of the eye, retina, the lens, everything gets displaced by this pressure, and the function of all these tissues in the eye begin to break down and literally go away. And then cataracts is a free radical damage to the very delicate, sensitive proteins in the lens of the eye. Now, cataracts, if you catch them in the earliest of stages, are reversible, but very quickly, cataract within months or certainly years, these early cataracts, once they get to a certain point, you can stop them sometimes from progressing, but you can't reverse them. And then there reaches a point with cataracts when there's not much you can do except surgery. From a nutritional standpoint, you can't fix it anymore, and so you need to do surgery. So the quicker you jump in on eye diseases, the better. I like to stop the ongoing damage, which means you got to get rid of gluten so you can maximize your absorption of nutrients. You got to get rid of fried foods and oils so you can get rid of the free radical damage. You got to get rid of trans fatty acids, heterocyclic acrylamides, because these sort of inflammatory foods, and that includes things like you don't even think about them, these coffee creamers and microwave popcorn, mayonnaise, stuff like that, are just loaded with the trans fatty acids, heterocyclamines, and acrylamides, and you want to stay away from them. Okay? Now, for the glaucoma, you got to reestablish circulation to those little blocked arteries, and macular degeneration we need to help the immune system in the eye begin to gobble up the pigment that's blocking the light from getting through the eye and causing gradual blindness. So, none of the bad foods, no fried foods, no processed meats, no oils. That means no olive oil, coconut oil, margarine, mayonnaise, salad dressing, cooking oils, and certainly no gluten, no wheat, no barley, rye, and oats. Now, I like to use the Healthy Brain and Heart Pack to support maintenance repair of the eye because it's part of the brain, and so what's ever good for the brain, good for the eye, and vice versa. So the Healthy Brain and Heart Pack, 1 per 100 pounds of body weight. I like to throw in Vision FX, which has lots of nutrients in there that are specifically required by the eye, including the luteins. And remember, the eye requires all 90 essential nutrients, so you don't want to cherry-pick nutrients. And then for the glaucoma, I want to reestablish circulation. I like to use the new Ultimate Cardio Sticks, and they will support healthy circulation through obstructed arteries, even the little bitty ones in the eye. And you're going to be happy you did all these things because your eyes will be better when you treat them well. We'll be back with Dead Doctors Don't Lie after these messages.